So, hello everybody, I'm Navinda. Most of you know me. I'm from Voluntary Action Islington, and I'm going to chair this with Councillor Una O'Halloran, Executive Member for Homes and Communities. Una, do you want to say hello to everybody?
Hello, everybody. It feels like we're back with old friends. When I see Jonathan, I just keep thinking of all our COVID meetings that got us through the last couple of years. It's good to see so many. I think there's some new people as well. We won't go round if you want to put your name in the chat, but it's just really lovely again. And I just can't thank the community enough, because it's the community that do all the outreach and get everybody mobilised, and you know, everyone, you play a part in your own, you know, particular thing. And I know we all care about the cost of living crisis and what it's doing to people, and I think we'll solve things together. So I'm going to let Navinda chair, and I'm going to shut up. But I just want to say thank you. This is the nice part of my job. So thanks.
Thank you, Una. But anything we can do to help you, do reach out to us. It's always nice to have a shoulder or two to, you know, to share the load. Okay, so today's agenda, we're going to hear from Jonathan. And then we will hear from Pam and Modi, who will talk about warm spaces. And there'll be an opportunity to have some updates or ask questions after each section. So, Jonathan, you ready? Do you need anything? You happy? Sorry, I don't know what kind of mood I'm in today. I'm just so.
Okay, well, we'll brief you on what's going on with COVID and flu, and then Navinda, you can give us a sense check about where your mood is on the basis of what you're saying. Okay. So anyway, so thanks for handing over. So for anyone who knows me in IT, we are now in a slightly perilous moment as I try to share my screen without anything going very wrong. So let's just see if I can do that. Now, can I just check, can everyone see that on their screens?
Yeah,
we can.
Okay, and Anne Mason is waiting to come in. Shall I admit her?
Yeah.
There you go, Anne. So I'm going to give an update about what's going on in terms of COVID-19 and flu, and a little bit about what we're doing in terms of vaccination and other help for people. My colleague Miriam Bullock may come in also a bit around sort of how we're doing around the vaccinations, etc. So I think we're in a very different position from when we were meeting last winter and, oh my goodness, the winter before. That's both because the pattern of COVID at the moment is different. It's also because for the last 2 years, we haven't had really very much flu at all, but it does look like we are now heading into another flu season this year, with the potential for it to be quite big. And underneath all of that is obviously, you know, there's a huge amount of social mixing and sort of return to sort of pre-COVID behaviours, but the vaccinations remain very effective in terms of protection against COVID-19 and also flu, and I'll talk a little bit about that. And then I'll give you a little bit of sense about how it's impacting on sort of the NHS and on our communities. So we don't have the same sort of data that we had previously. So if for those of you who've been following us for a while, we used to do a huge amount of testing in the population that would give us real-time data about people who were sort of symptomatic or asymptomatic, but are advised to regularly test and what that would do. Now we are very reliant on local data and national data, and the national data comes from surveys of the population where people test, and we can check to see whether or not they have got COVID. And those are also then sequenced, which means that we can detect what sort of COVID people have. And obviously that's very important because we know that the virus mutates over time, and that if you get a significant mutation, then that could have a fairly significant effect on the population. We saw that with Omicron, we saw it with Delta, amongst others. So that's something that we can continue to keep an eye out. And then we also have data from the NHS in terms of admissions and other indicators. So this slide is showing what our most recent information about infection rates from COVID-19 look like. So none of this is specific to Islington, but it gives us a general sense about what is going on. So the figure on the left gives us the percentage of people testing positive for COVID-19 really over the last year. So starting on the left-hand side back in mid-November 2021, all the way through to the most recent week that we have, which is the week of the 15th of November. And as you can see, we've had periods of time when there have been very high levels of infection rates in the community in total. So you can see, you know, if you look at the left-hand side, sort of Christmas, New Year, where we had around 7 to 8% of people testing positive, and then we had another significant spike roughly in sort of March, April time when VAI began to become the dominant variant, and then we've got another sort of spike happening in sort of early summer, falling back over most of the summer period into the early winter. We then had a bump in sort of September and early October, which has subsequently been falling, and we've seen falling rates now for the last several weeks. So for the most recent week, it was estimated that about 1.5%, 1.48% of the population of England were testing positive for COVID, and that represents about 1 in every 65 people living in the country. London had a lower rate of positivity. It was about 1.3%. That was statistically actually roughly similar, but London's been trending slightly lower than the rest of the country over most of sort of the autumn and winter period. So that's still a high level, but it's nowhere near the levels that we were seeing sort of during those other peaks back in sort of December, January time, March, April, sort of early in the summer. And that's good news to the extent that we were all worried that the winter period would be a period when we would see actually quite an upsurge in COVID infections, because obviously it gets colder, we're more likely to be indoors and sort of in closer groupings, etc. And we're that much further away from sort of lockdown restrictions and sort of changes in social behaviour that would have been protective as well. It also shows that the vaccinations are continuing to be protective against the population, and that the boosters in particular are helping to protect some of our most vulnerable residents and members of the community, which is good news. The figure on the right hand side shows the positivity rate in London, and the most recent positivity rate has sort of dropped back to about 1.3%, as you can see. In terms of the R rate, remember that when we all used to follow the R rate, and if you're in my role you still do, the R rate is basically what the transmission looks like from one person with the infection onto others. So if you've got an R rate of 1, that means for every person who's got the infection, 1 more person will become infected. So that's steady transmission. If you've got a figure below 1, so here we've got 0.8 to 1 as the range, it means that the ongoing transmission is falling. If you had a higher figure, say 2, that would mean for every infection we're seeing at the moment, there would be likely to be 2 new infections in the near future, and that would be sort of an indication of rapid growth. What we're seeing is a best case, an estimate of that we're in the range of about 0.8 to 1, and what that means in a practical term is actually we're either sort of steady-ish or falling, so -1 to about -4% growth rate per day in London at the moment. So it suggests that we are still in a downward phase at the current time. So in terms of what's going on in terms of COVID itself, we are still experiencing a position where Omicron BA.5, and there's a particular subvariant which is becoming more dominant, are still dominant in the UK, accounting for more than 75% of sequence samples in the UK. Now, one of the things which is different about the current, so that obviously that's been circulating around for some time in the UK, sort of roughly from sort of March, April time. Vaccines are known to be highly effective in terms of protecting against serious disease resulting from Omicron BA.5, and we know that the morbidity and the mortality, although they are important, are less than in some of the other variants of COVID that we've had over time. So still dominant, vaccines still protective, but there's now, and this is sort of different, I think, from any other period of time that we had with COVID, there's a large number of subvariants circulating in the UK. Now, many of those are often at lower level, but many of them share fairly similar mutations and have the potential for growth. And one of them, which has sort of emerged over the last several weeks, BQ.1, which is a sublineage of BA.5, so in other words, it's sort of descended from and is similar to BA.5, but has some different mutations, which means it's slightly more able to evade vaccine and previous immunity that people might have had from having had previous infection, has been increasing, and it's accounting for a high proportion of cases at the moment. But it still remains the case, although BQ1 and some of the others may have advantages over BA.5 in terms of infection, there's nothing to suggest that they're more likely to cause serious illness or need for hospitalisation or mortality at the current time. And there's also other variants which are emerging, which in the lab, when we look at them, may yet continue to contribute to transmission to the future. So i.e. there's some new subvariants emerging which may yet be able to further neutralise previous immunity, whether it's from vaccines or from previous infection. But again, they are sublineages of BA.2, which is the one which was sort of dominant in the sort of the early spring, rather than sort of new variants, which are very new variants which have emerged. This is just showing COVID-19 patients in hospital. I'm using London data rather than sort of North Central London or Islington data, just to give a better sense about what the trends are like. So you can see this goes all the way back to the first wave in sort of March and April of 2020, where you can see the very high peaks. Then we saw an even higher peak around January 2021, another peak back again around sort of December, January time, when Omicron emerged and sort of had a very, very high infection rate. And then you can see falling back again, but coming back up with BA.2, then coming back up with BA.5, but again, falling back over time. It is, however, worth noting that patients in hospital with COVID, and this is anyone who's got COVID, it's not necessarily because they've been admitted with COVID, it's worth noticing that the proportion in hospital is now appreciably higher than the lows that we had in the middle of 2020 and the middle of 2021. And that really points to continuing infection control challenges, bed management challenges in the NHS, which are contributing to some of the difficulties. Now, the other thing which is also very different is the proportion of patients who are in with COVID, but where actually they've been admitted for other reasons. So these are, when we look at that, only about 20% to maybe 25% of patients who have COVID in hospital have been admitted with the primary diagnosis of COVID. Others are in for other reasons, but happen to have COVID. And why is that happening? Well, because there is general community transmission. If you're testing in hospital, we're not testing in the community, you will pick up those infections. And of course, we test in hospital to help to ensure that we can help to protect people against infection risk whilst they are admitted. And this is this is an indication of proportion of people who are becoming seriously unwell in London and requiring a ventilation. And what you can see is, again, that first wave back in 2020, the second wave sort of back in sort of January 2021, very high proportions of people becoming seriously ill, requiring ventilation, and that sadly also translated into mortality. But if you go to January 2022, when we also had that huge spike around Omicron, mixture of a difference in the way in which that variant infects people, so much more likely to be sort of in your upper airways, in your windpipe, than deep down into your lungs, which is where you sort of have the scope for much more serious illness. Previous immunity, mainly through vaccination, but also through having acquired immunity from having had previous infection, all really, really reducing the proportion of people going into hospital. And you can see that even with the BA2 and BA5 variants having very high levels of infection in the community, again, relatively few people going into hospital requiring ventilation. And that's a picture in north central London, as well as London-wide. And then the mortality position also reflects that. It is worth saying that cumulatively, mortality from COVID does remain important, but it has significantly dropped down the causes of death locally in London and nationally compared to 2020 and 2021, when it was sort of top 2, top 3 causes of death in both of those years. It's now sort of top 10 and sort of dropping. So it's appreciable and it's important, but it is sort of more, again, another sign that there's a high level of protection in the community and that we are helping to reduce some of the worst impacts. And this is just a position over the most recent 3 months across London, so you get a more granular sense about what the recent trend is. You can see sort of falling down really since sort of mid to late October. Just general respiratory infections remain very high, and it's accounting for a reasonable proportion of emergency department attendances. And also just say that we are seeing a fair number of acute respiratory outbreaks. But again, if we compare it to sort of the peaks when we had a lot of sort of new sort of Omicron hitting sort of last winter, etc., it's sort of been, and then BA2 is also running at a lower rate. However, not such good news. Influenza-like illness is definitely coming back. So we haven't really had an awful lot of flu in the last couple of years, and that's really because all of the social distancing, lockdown, social isolation measures which we used to control COVID actually had even more of an impact on flu. And that was really because flu sort of moves around the globe on an annual basis. And if sort of the period of time when it would usually have hit sort of the United Kingdom was a period when we were all following a lot of restrictions, social isolation, etc., never really got a chance to get really much of a foothold. And that wasn't just in the United Kingdom, that was pretty much across the whole of the world. And in fact, one of the major strain, one of the subtypes of B strain influenza, we think may actually become extinct during 2020 and 21. That doesn't mean that flu, which has got various strains, has become extinct, and it's definitely on the back, but it showed you just what impact that had. Now, unfortunately, what we're seeing is we're in the early foothills of what looks like a fairly big flu outbreak. Now, again, I don't have a crystal ball. I can't absolutely predict what's going to happen, but the trends, as we're looking at it, it's got all of the antecedents of a fairly big outbreak of flu this winter. And the reason why I say that is in this more recent data. So this is about confirmed influenza. This isn't influenza-like illness. This is confirmed influenza, which is being picked up through GP spotter practices. Now, the absolute numbers are relatively small, but as a tracker, is a very accurate way of looking at what's going on in terms of flu within the country. And I would simply direct your attention to previous years, which are represented by sort of the grey, turquoise, red, and yellow or amber lines for previous years, showing what those patterns look like. And then if you look at the purple line, which is also sort of with the bar charts, what we can see is that we've got an earlier increase in that positivity rate, and that the trend has got all the makings of a fairly sharp outbreak. And supporting that has been the experience of other countries that have already had their flu season. So thinking in particular countries like Australia and New Zealand, which had very big flu outbreaks in the past year. This is also happening earlier. So roughly probably around 6 to 8 weeks earlier than we would usually expect from a flu season. And the other risk that we've got is that what is circulating, the dominant strain, is influenza A. And influenza A is associated with more serious illness, and it's associated with bigger outbreaks. Now, again, the good news is that the flu vaccine, which we update every year, includes protection against the circulating strains of influenza in the UK. So it should give a good level of protection. Now, remember, flu vaccination works very similarly to COVID vaccination. It doesn't necessarily protect you against getting the infection, but what it's highly effective at is reducing the risk that you're going to become seriously ill and might need to go into hospital. And obviously the thing that we are concerned about is that if we see another upsurge in COVID alongside what might be a big influenza outbreak, is that actually COVID and flu together is not a good combination. So in terms of flu vaccination, we are still offering a lot of vaccinations. We saw most activity happening in Islington in October. We're mainly providing vaccinations through community pharmacy sites, but we've also got St. Luke's offering vaccinations. At the current time, or rather as of, this is actually data from 2 weeks ago, we had around 46% of our population protected with the most recent autumn booster. And we were seeing an increase of about 1,100 people each week in terms of that uptake. That is still broadly beginning to sort of tail off a bit. Difficult to interpret some of the data because now we've got a sense of how many boosters are you eligible for, which of the boosters have you actually had. So there's probably an undercount of people who've got a recent booster, but these are the ones who had all fully up to date in terms of being eligible for that autumn booster, around 46% at the current time, much higher in our older age groups than in younger clinically vulnerable groups, which is what we saw with the major sort of first doses of COVID vaccination. An influenza vaccine at the current time is running about 29% with about 32,000 eligible people vaccinated, and it's increasing at about 1,800 per week. And again, we saw a lot of activity in October beginning to fall off through November. In terms of sort of how we compare with previous years for a flu vaccine, we're probably slightly ahead in Islington compared to what we've been, but there is still, obviously, that means there is a fair amount of vulnerability in our population. Again, older people much more likely to have the vaccine than other eligible groups. And this is just giving an update about sort of the breakdown. So as you can see, people aged 65 years or older, around 58% have been vaccinated. In most other groups, the rates are lower. We are going back into our care homes. You see the CQC registered care homes. We've got very high uptake for COVID. We went in very early, probably around 95% uptake, which is really important because that is one of our absolutely most vulnerable groups of residents and our settings. And that gives a lot of protection. But we went in so early, it was before the flu vaccines were available. So there's now catch-up activity going on in those settings. And that just shows you what the vaccination uptake has looked like over time in the borough, both in total and by age groups. And then in terms of comms, resources and events, I've almost finished, I promise you, Navinda. It's just worth saying that we've got a range of vaccine resources which are available. So there's material for social care staff. We've got various access to communications campaign materials. There's a wealth of information available through the NHS website, also for Islington Council, and we're going to be disseminating out more information, I think next week from the council, again encouraging people about ways to be able to access vaccinations and to stay safe and to protect each other. And I think I'm going to then start moving into cold weather resources, which is going to tread on others' toes. So I will stop here and stop sharing and hand back to you, Navinda.
Thank you, Jonathan. I just wondered if people wanted to ask any questions. That's really thorough. And we can send the slides across so that people can link into the resources. But I just wanted to sort of mention a couple of our community sites that are still continuing to provide the flu and the COVID vaccinations, and now polio and other immunizations. So we've just at the Union Chapel, they're working with people experiencing homelessness, and there's a pop-up project there, and that's on Wednesday, 7th of December. We'll send all this. I'm sure you've seen it through VAI News, but there are other upcoming vaccine pop-ups and walk-ins, and some of you may know already about St Luke's. That's been going for a while. Mildmay Community Centre, Hornsey Rise Health Centre. Colin, are you still doing stuff at Brickworks?
No,
that's why you're not on the list. Yeah.
No, we're not
Okay.
doing any no pop-ups.
Okay, great. Okay, so, and I know that Sherry is doing something at the Business Design Centre on the 12th of December, and we can send you information about that too. So there's still quite a lot of ways to access vaccinations, boosters, and we're still doing evergreens, are we, Jonathan? So we're still doing first jabs, and yeah, and the flu and COVID are all given together if you want them. Is that correct?
Yes, so
Yes.
you can have both done. And it's perfectly safe to have the two together.
Great, thank you. Does anybody have any questions for Jonathan or? And Jonathan, you know, as the numbers are going down in terms of COVID, is that because less people have been testing themselves, or because that seems, one would expect that real rise? Obviously that's happening with flu, but why is it not happening with COVID? Is it because of the autumn booster campaign and our?
So I think cumulatively there is, so essentially we've got VAI or a similar subvariant are dominant, and that's been the case now for quite some time. So roughly since, I think, probably about May, June. So that means an awful lot of people have had the previous infection. There's been obviously a high level of vaccination. Some people have got booster vaccinations offered in the spring, particularly our most vulnerable groups, and we've obviously got the autumn vaccinations as well. So I think the mixture of, we haven't got, if you like, a very new variant, which is sort of overtaking the other, is helping to reduce the numbers. And then we've got the, if you like, cumulative immunity within the population, which is protective. Now, to be clear, immunity still wanes, and that's why the booster vaccinations are necessary. In fact, I wouldn't call them boosters. I think boosters are actually one of the things which stop people, you know, make people think, well, why do I need a booster when I've got the original vaccination? What they are actually necessary to do is to keep you safe and protected, because we know that the body's immune system for this particular infection forgets over time how to respond. You lose the antibody response, some of the T2 cell response. So I think it's that sort of mixture which are coming into play, Navinda.
Thank you, Jonathan. And Paul and Colin have got their hands up. So I don't know who had hands up first.
Paul,
go for it, Paul.
Thank you very much. I just want to ask a quick question about the eligibility for the booster in terms of, I'm just thinking about my team. We support vulnerable residents, but that can include people with kind of physical disabilities or mental health issues. So in terms of residents being eligible, but I'm also thinking about my staff team as well, who come into contact with residents kind of every day of the week. Would they be eligible as well to get an autumn booster?
So for COVID, the booster really in terms of health conditions is now less than would have been the case when we were first rolling out COVID. And that really is based on our understanding about how people with long-term conditions react to COVID. So effectively, people who have got their immune systems are compromised are people who would be indicated for boosters. So that could include autoimmune conditions, say, such as some forms of arthritis, for example. It might also include people who are on treatments, or which could be shorter, more acute term treatments, such as, say, for chemotherapy for cancers, or longer term therapy. So those would be the groups that would generally be indicated, and they would be approached by their GP, advising them of their eligibility around that. Flu vaccinations do go a lot wider, and they also go into younger age groups. So Paul, I know although your team are very youthful of spirit, we know that actually there's a fair proportion who are older. So for example, flu vaccination is available for people sort of at 50 and over, in the way that in previous years it hadn't been. So probably the most useful thing is we just drop you a note just sort of outlining who's eligible and who's not. And we've shared that also through sort of internal bulletins, etc.
Thank you.
Thank you, Paul. Colin?
Yeah, just touching on that. Yeah, we asked about eligibility, when people can go, and are there any target groups that we're trying to get to take the flu vaccine. So apologies if that was asked, but I missed the start of the conversation. Again, that we could possibly, for our centres, talk to answer this. And another point I was asked about was people that homeless people, in terms of how they could they access services. Is it the pop-ins? Apologies again if that's been asked, but I thought I'd just answer anyway.
Okay, so there's, oh, what have I done? Okay, so I thought I'd muted myself. So there's a fairly long list for flu eligibility. So let me bring that up, because it's like an exam question where I can never remember all the different groupings. Bear with me a second.
Yeah.
And
I kind of
Colin,
agree with you. Yeah, I kind of agree. Yeah, go on,
earlier
sorry.
I just kind of did a little roundup, but maybe you missed that. So
I
'cause
did.
I
Sorry.
did do it really quickly. I'm sorry. So at the Union Chapel, they are working. There's a pop-up clinic for those experiencing homelessness. You'll know it. It's the
Yeah, I know Union
Chapel
Chapel.
and the
Is there any
Margins
difference?
Project.
Are there any geographically closer? Because obviously we're in Finsbury Park, that's a bit of a trek from to Union Chapel. I
Yeah.
don't know if there's anything like, central, north, and south. I don't know, but maybe we could signpost people to where they are. Because again, we have been asked, so we've.
Miriam's ready to come in on that point,
Marvellous.
and then
Okay,
Jonathan
thank
can
Oh,
come back.
well, yeah, but there isn't anything specific that we have in the diary, Colin, specifically for people experiencing homelessness.
Okay.
They can of course go to any pop-up, or in any clinic. But in terms of specific events for that group of people, there isn't anything forthcoming in the north of the borough. But let me.
Yeah. That's fine, Miriam. As long as they can access it, because some of them felt that they couldn't access it, so I can go back to the group. Okay, all right. Thank you.
They're welcome at any centre, definitely. But I do understand it. It's not as easy as saying yes. You're welcome to go. People sometimes feel uncomfortable, don't they? But yeah, if people can make their way to Union Chapel on the 8th, then it's not only vaccine that's offered there, but it's the usual services that the Margins organisation offers. So hot meals, drink, showers, laundry, general advice. So yeah, they'd be encouraged to go there.
Okay.
And it's on the 7th, I understand. And it's the morning session, 10 till the afternoon, a 4-hour slot on the 7th of December, is that right? I think that's what came through on the on VAI News.
Yeah, it was sent. Gizem sent an email today.
Yeah, she did. Yeah, that's where I'm gonna. That's where I've got
It's
it
in your inbox.
Yeah. Thank you. And so, Jonathan, you were going to talk. Clarify around eligibility.
Yeah, so remember that we've got, so I think particularly because the eligibility thing feels different, well, it is different for autumn COVID. It is the case that people need to take your word for it. That's the guidance. They're not waiting for people to bring proof. You don't need an NHS number. You don't need to be registered with a GP. And I think particularly since we're delivering so much through the community pharmacies, which are sort of scattered through the borough, that does give some of that access. The other thing, we've obviously been working with our substance misuse services to also offer vaccinations alongside some of that, including via community pharmacies. So again, a proportion of that population will be homeless, although we've done an awful lot to help bring people in and to protect them through that period of time. So I hope that gives some answer to that. In terms of our flu eligibility, the key target groups are people who are 65 years or older, people who are under 65 and have a health condition which presents a risk, then all other 50 to 64-year-olds who do not otherwise have such a health condition, pregnant women, people with learning disabilities, people who are living in CQC registered care homes of any age or any other care home resident. We also, with the flu jabs, children are also important, and that's both to minimise disruption to their education, to their schooling. It's also because children are also, unlike COVID, flu outbreaks, schools play quite a big role in community transmission. So both for children's own health and well-being, their educational well-being, and for the community, we also offer vaccinations to children aged 2 to 3 and children aged of primary school age.
And Jonathan, Councillor Jeeps has asked, is there a charge for the flu vaccine for non-target groups?
Yes, there is, sadly. So if you're in one of the eligible groups, it is free of charge on the NHS. If you're not, some community pharmacies will offer vaccinations. The Islington Council offer vaccinations to all of its employees. Now, we've got a lot of employees that fall into vulnerable groupings in any case, but there are voucher schemes that people can do. We've also had some clinics come into the council. I got my flu jab almost in this room next door at 2 to 2, and lots of other employers do that. And I would encourage all employers to think about doing that to protect their staff and the community.
Thank you. And there was a question from Sarah Martin. It was just wanted to be put in touch with public health around walking groups. And Sarah, I'll do that. Pick that up tomorrow. I'll email you. Yeah, great. Okay. And if I forget, please do remind me. And from Alag, there's a question: do autistic individuals without a learning disability, are they eligible? Autistic individuals without a learning disability.
I think we can check and get back. I don't know if Miriam has got more accurate. I think I think it tends to be people with an intellectual learning disability as opposed to what might be people with high functioning autism, but I will double check. There's some other factors in there as to why there's vulnerability.
Yeah. So Zainab, do you want to pick that up with me just in case to make the connections? Yeah.
Thanks very much. Thank you.
Thank you, Zainab. Okay, right, Modi, we can see you and not your white desk and a mouse. So that's good. Do you have, I've made you co-host so you could share your slides.
I think it might have reset it because I came back out to source on my camera.
Oh, good. Shall I just do that again? I'll just
yes, please.
make you co-host. Wow, you're on it. Brilliant. Okay. All right. Over to you, Modi.
Brilliant.
You're going to talk about winter well-being. Sorry, no, warm spaces.
So it's going to be Pam and I hopefully are going to cover really quickly the cost of living and our community warm spaces. Can you see my
We can see your screen. Thank you, Modi.
Presentation. Yeah. Brilliant. Oh, I'm trying to. So hopefully I'm going to try and do a quick roundup regarding the council's support around the cost of living at the moment. So we've got our council website, which outlines all the offer of the support that we're offering at the moment. So the support around sort of benefit, money and debt advice, energy, help for children, and there's also our community warm spaces as well. So as well as the council website, there's also posters around the borough. I'm not sure if people have seen those posters around sort of the support that the council are offering around the cost of living support at the moment. But just trying to highlight the areas that we're delivering some of our support is around sort of financial support, tackling poverty, employment support, helping with energy costs. As you can imagine, that's probably one of the in-demand support that we are coming through to the council. So we've got our Shine team, our energy doctors, and in terms of our community partnership team around support around some of the grant making as well. There's obviously across the borough, there's support around food partnership as well. The support around sort of businesses. We're having lots of conversation as a council with sort of businesses in terms of how they can support residents and family as part of the cost of living crisis. Pam and I will talk more around the community warm spaces and how businesses are supporting a lot of that initiative. And as always, in terms of the VCS partnership, there's strong support across the VCS around sort of grants and local project, as well as some of the relief grants that we offered some of our partners. So again, there's housing support as well as individual council colleagues who are going out in the community to support families and individuals and residents across our community centres as well as our other community spaces as a whole. So this is to give you an overview of the kind of support that the council are delivering to kind of support individuals and families currently as part of the cost of living crisis. And I think, not sure if people have come across these campaigns. So the council have been delivering lots of campaigns around sort of the cost of living crisis. There's a dedicated number for residents and family that you can call if you know anyone's experiencing some of the difficulties, that they can call specialist workers who can support individuals and residents around the things I've outlined already. So there's a dedicated number. And I think since September the 6th, there was a number that was dedicated. There's been an increase in terms of the phone calls, the numbers that are coming through there. We're training up more members of staff to support some of this call. And it's also worth noting, if people are struggling to get through this call, there's a callback function. So if you can't get through and there's a long queue, and if you do hang up, there's a function that the colleagues that are manning those lines will call you back as well. So we've heard some feedback that residents have been on hold for an hour plus. What we're hoping, we've been training up more staff to bring that wait time down. But if you are waiting, you could just hang up and they will log your call and you will get a call back, so people are not on endless waits forever. So that hopefully will bring down some of that information. So that's sort of an overview in terms of the cost of living campaign that we're running as a council, and there's posters and support, and there's an email address as well in terms of supporting families and residents who are experiencing difficulties at the moment. And we're constantly working with our partners in the sector as well in terms of what we can do more. So as well as the website and these posters, there's the usual support. So if you go into community centres for your support, hopefully you'll see some of these support as well, and workers in those spaces as well can support you to address some of the residents' helps around these issues in the same way. Pam, I'm not sure if you wanted to come in and anything around the cost of living support from the council. I'm looking across because Pam and I are in the same room at the moment.
Nothing to add.
Okay, then we can move on in terms of our warm spaces. So as the council, we've been working with, again, our partners across the sector to deliver warm spaces, because we recognise that the cost of living and the cost of heating and properties and people's homes has been a massive issue. Since the launch in early September, we've have around 40 community spaces that have come online at the moment. So these are a list of some of them. Some of them have been cut off because of this presentation. We've broken them up into locality based, so into the central, the borough, the south, and the north of the borough as well. And they're covering a range of services across 7 days a week as well. Just as an overview, you can find a lot of those centres on our website. So we've got our council directory where you can go to, and in the third or the fifth box, it talks about community connections. You would click on that, and it should take you onto sort of community pages, and you can see in that way it shows you the number of community warm spaces that are active at the moment. So we've got 41 spaces as of yesterday, and they go up on a daily basis. We have lots of our partners who are online who are supporting that. So the Octopus Network and Roz has been great in terms of some of the faith spaces in supporting some of those spaces coming on as community warm spaces. And we're asking for more partners and colleagues to get in touch as offering those warm spaces. There's a sets of principles that we can send people who are interested in operating as a warm space as well. And we've had lots of interest from our business partners in terms of operating as warm spaces. The guidance we've given them around that is around no barriers to entry. So in terms of community setting, community spaces are used to hosting residents and members of public going into that. So when businesses are approaching us to be at a warm space, we give them the same sort of principles. There can't be any hidden costs. There's no point asking, turning a coffee shop into a warm space. Then there's a hidden cost that someone has to buy a coffee to stay in. So the set of principles that we're offering to businesses who are wanting to offer the same opportunity around none of the hidden costs, no barriers to entry. If there is a barrier to entry originally, how do you overcome that in terms of signage and posters, in terms of overcoming some of those issues? Pam and other colleagues have been, the driving force in sort of getting these spaces online. And there's a question around how up to date this information is. So Pam and other colleagues maintain this, and we review it regularly. We recognize the weather has been holding a little bit, even though today's been colder than usual. We're confident that other warm spaces will come online as we go on throughout the year. As the weather gets worse, we have other partners who are waiting before offering their warm spaces because they are still waiting. They're still seeing how the weather holds out. The plan is if they hold on now and not offer these warm spaces now, it enabled us to add it to the end of the year because we're not sure how long this will last. We've sort of primarily linked it with going from September to March next year. But if some of the spaces don't come live till next year, that March deadline moves on into some of the summer months as well. So hopefully we'll have a longer coverage in terms of community warm spaces as an offer. Pam, I'm not sure if you want to come in terms of the warm spaces.
No, I think you've covered everything. Yes, if people got questions.
Yeah, I'm just conscious of time, so hence the fast speaking because we've got like 10 minutes left. So I'm not sure if, yeah, the last slide I had is just around questions. I will stop sharing so I can see everybody. And yeah, if we have any
Great,
questions.
Modi, Pam, thank you. So just for others, so Jonathan put in the chat the guidance from MenCap in terms of accessing flu jabs. So Zainab, it's in the chat. We can pick it up if you don't manage to get that link. And I can see Kevin's is asking a question. Once you've stopped sharing screen, Modi, we can have a look at people.
I'm trying.
Oh,
That's the
bless.
button I was looking for. Apologies.
Oh, well done. Great, thank you. That's amazing. 41 spaces and still more that can be on offer. So if you send us the slides and the principles and what package of support organisations can access in order to be a warm space, that would be great. And anything else, then we can circulate it to this group and then wider. Fantastic. So Kevin.
Yeah, and that sounds really good. Just a question on the warm spaces, Modi. Have you been able to do any tracking around how that spreads over the week? So do you know that in each locality, there's kind of different places on different days? Because I know some people aren't doing it every day. So is there kind of, are you able to kind of map that kind of detail?
Yeah, thanks, Kevin. Thanks for the question. I think it's a very good question. I think in terms of in extending your question, what we've noticed, there's a lack. We've got good coverage Monday to Friday in terms of range of warm spaces, so family-friendly spaces, young people. It's the weekend offer of that's been a bit more harder to cover. So across the 3 localities, we could do with more weekend offer because, as you can imagine, Monday to Friday, lots of spaces are normally open. And in terms of tracking, it's been slow because the weather has held up a little bit. So some of these spaces are active, but for some organizations, it's business as usual. So they're normally open, they're normally offering those activities anyway. So tracking has been, we're holding back a little bit in terms of seeing how the weather changes. And with it using a website rather than a poster, we can take some places offline really, really quickly. So if we see the trend that other spaces are more popular or people are not using spaces, or if there's a need in one area, we can bring online other partners quicker as well. So I'm not sure if that answers your question.
I'm just going to pick up one question in the chat and then Colin and then Mabratu. So from Laura's asking, how warm does a warm space need to be? Laura's thinking of opening up the Pleasance Theatre, but is conscious of sustainability and obviously heating bills. So I suppose that's all going to be covered in the package of support that you're offering organisations. But do you know how, well, you will know, how warm does
it's a very good question, I think, definitely. I think what we're asking partners, don't do anything that you don't normally do. So if you're normally open on that particular day and you can stay open an hour later, that warm enough, I think is for us in terms of temperature guidance. What we're asking, there's no point in you putting on a warm space as an additional activity, which then increases your heating bill, then it defeats the whole object. For us, in terms of guidance of temperature, we don't have that. We're just saying, actually, if you have existing program, existing offer, can you turn that into a warm space? Or if you turn off your heating, most spaces can stay warm for another hour. Tagging something at the end is more useful than developing something new from scratch to meet this need. It defeats the whole object because that increases your heating bill and your gas bill. Yeah, it's not helpful in that way.
Thank you, Modi. Colin and then Mabratu.
Yeah, just really quickly for Kevin, just to say, I think in terms of accessibility, we certainly need more weekends and ones that open slightly in the evenings as well. My community centre opens from 8 till 10. They had quite a big take up, but there's also challenges in terms of having one member of staff on. You need a lot of resources, so but we definitely need more. I know, and with that in mind, I know that the Odeon Cinema have offered to be at Sadler's Wells have offered something in the evenings, but if we're looking for more provision, I think more around the evenings and weekends is certainly one of the ones. And we are collecting data in terms of people that are coming through. Just like data, we're not saying, not being really intrusive, but I think as Modi said, as we go along, we may think about what other data we need to make sure that they're effective.
Yeah, definitely. There's lots of requests from businesses in terms of wanting to do this, but it's that conversation around barriers to entry. So if normally I know your place I have to pay to get in, like a cinema, for example, how do you promote that differently so I'm aware that's a warm space? So those conversations are still happening with those partners who normally you would pay to access those spaces.
Yeah, the cinemas say free of charge, but you won't get free popcorn, but they get free. Okay, no popcorn. Okay.
Thank you, Colin. Mabratu?
Okay, thank you, Navinda. My question to Modi is the cost of living. The telephone dedicated to the residents is very extremely busy. I tried myself and then I hung on, around 20-25 minutes. And then somebody told me as well 40 minutes. Another one as well 25 minutes, and then he just give up. So is there any, it's a great service, to do the council, but is there any way to improve that, service, maybe adding some number or adding some advisors on that? The other question to, Jonathan as well. If I followed properly, Jonathan was saying a new merging, COVID. I can't remember the name, something like that. How serious is the new emerging COVID as well for Jonathan? Thank you. Okay,
so I'll answer the first question then, Jonathan, if you can come in for the. So in terms of the dedicated number, last week the calls, because from the 6th of September is when we start promoting the number more. So the call went up by 1,000% is the data that I saw last week. Last week they were training up 10 more members of staff to be able to take out some of the call, and that's why I've said about if rather than waiting and holding on the call for 25 minutes or 30 minutes, if you hang up, it's staff members will phone you back. Because last week we had lots of report around numbers, lots of waiting time. We had around an hour plus. What I've been promised by the team who are delivering this, that they are constantly training more members of staff to take up more calls. But the advice would be, rather than waiting for 25 minutes, if you hang up, there's a callback service. They will call you when a member of staff is free, but they are constantly training up more staff to be able to take up the calls.
Okay. Thank you.
Thank you. Tina put a question in the chat, but this is about our organisational utility bills and is there any way of finding help? We're going through this at VAI, and I'm sure every charity, every organisation that is, leases a building or owns a building is going through this.
Yeah.
Anything locally or nationally that people know about? All I know is today we've tried to get a reduction in the VAT. So it's 5% as opposed to 20% on the energy bills, but you have to have sign a new contract if you're running up to a new end of your contract, that kind of thing. Tina, I can send you what we've been looking at if that's of any help. It's only applicable to our VAT aspect, but like you, I think that doubling of the energy bills is about the average, because we're ours is about 20,000, it's going to be 40,000, and I think you're saying exactly the same. Yours is almost like just over that doubling, isn't it? So
Navinda, sorry to come in, I can't find the hand button. I brought this up about I've brought this up with the cost of living, about energy businesses and community centres especially, because I'm really conscious of they were hit through pandemic, room hire, everything else, and now energy. So I think I'm going to just speak to the business people again and say, if there is anything, if that's okay, if I send it through Navinda and Pam and that, and we get it out. I am sure, and I could be, because I did a whole presentation the other week, there is some kind of other fund, you know, like for help with this. So
And
you
is
know,
it local? Is it?
yeah, I don't, you know, it's either I read it in one of our papers or I presented it somewhere. You know, there's
Okay.
different pots of grants now.
Yeah.
But I've mentioned the community centres and the community, because that's the last thing we want is our communities going under. So I think I'll go back to someone and Robbie Rainberg and them and say, can you send it out if there is of businesses like the charities or the hubs, or how do we,
That would be so helpful, because
yeah,
we've
I'll do
just,
that,
the doubling in personal, households is one bit, and then you've got the doubling in our organisations, which we just hadn't expected.
Modi, can
yeah.
you take this back as an
Yeah.
action, just to go to Robbie Rainberg, copy in Stephen Biggs, because I actually mentioned it to them, you know, like
That's
it's all
very
right, you know,
helpful.
because I was like thinking Collins and Luke's and all the networks, Octopus. So like I was like just saying what we're doing to help them. Do you know what I mean? So
Yeah.
and we'll push on this end as well.
Thank you so much, Una, for taking that up, and
no, I
Tina
think
for
it's
asking the question.
important.
Yeah, brilliant. I think, Jonathan, you've posted some answers to questions. To answer the question about risk and severity, so this is Mabratu's question about a new subvariance. Jonathan, do you want to just say it? Because you'll do it far better than me reading from your chat.
I'm not sure. So I think every time any new subvariants, which are sort of distinctly different from what's been around before, come through, we always have to actually study them to find out, are they actually different? Do they pose more risk or not? We often don't know for at least several weeks, but you know, that's relatively fast. I think from first principles at the moment, what is emerging are still variants of BA2 and BA5 Omicron. So they are sort of mutations of, but they're not jumps. Where we've had real risk has been where we've seen a jump, so from the original to Alpha to Delta to Omicron. So at the moment, from first principles, they are less likely to present a new very serious risk across the population, but we do need to continue to track that. And obviously I'm mindful that although COVID is on the way down at the moment, COVID plus flu, which may be on the way up, isn't a very good, is not a good combination. So that's possibly the more likely risk, that we have the two together rather than that there will be a new variant. But the thing obviously with COVID, or with with COVID in particular, is it could jump, and it could jump unexpectedly, but we don't know. I don't have a crystal ball on that one.
Thank you, Jonathan. So informative today, as always. Thank you. I think we can let you go, so you can have a nice early evening away from the screens. So thank you, Jonathan. Thank you, Modi, Pam, and thank you and Una and other colleagues.
No, thank
Paul,
everybody else.
Paul, did you? Yeah, Paul got his hand in right at the end. Go on. Is there a very quick question you wanted to?
Thank you very much. It's not actually a question. I just want to remind everybody about the new LVI coaching service, which is launched, adults who aren't eligible for statutory services. So some of you might be well aware of this already, but if you're not, please reach out to me. I'll stick my email in the chat and we can do the presentation.
Paul, anything you want to send us, we can include in the other presentations.
Great, okay.
So we can do a package of presentations so that people
Excellent.
can have access to everything.
Brilliant.
And is that Michelle?
Yes. I thought I saw something. It was sent out by you, actually, not you personally, but Voluntary Action Islington.
What was that one?
The London Community Foundation. Applications for the Together for London programme to support your organisation through cost of living.
Yes, we did send that through. Yeah.
I'm just having a look whether it was.
Good reminder.
Hang on, I'm just looking to see whether it was directly for the organisation or is funding charities directly responding to the cost of living crisis and prioritising those who are working with people in communities who are disproportionately impacted by it. But
great. Yeah. What's the but?
I think it's expired now.
The deadline. Yeah, we did send it out, and it was up to
November.
Yeah, it was a really quick turnaround, as I remember, and
Yeah,
it was
they
up to
always
about
are, aren't they?
£10,000. Yeah, you have to
Yeah,
almost
have
like
to just
do it
keep
on the
looking
day.
out, because you don't know whether the mayor's fund, might put something out for voluntary groups in London.
Yeah, we'll make sure that we resend. We send it as soon as we get it, but then
Yeah,
and then we send out quite a lot of other information, and then it gets sort of
yeah, but you don't know whether there'll be other pockets coming through, but
Very
hopefully there will
true.
be.
Yeah.
But
fingers
that's the only thing I remember seeing.
Thank you for.
If I come
saying that.
across anything though,
Yep.
because I look around, then I'll
That
let
would
you
be
know.
really
You can
helpful.
put it out. Yeah.
Thank you.
Okay.
Okay. Yeah. So Tina's talking about just insulation for households that's going to be available from next spring. Okay. All right. Thank you, everybody. It's lovely to see you all.
Thank you.
And yes, and we'll be in touch again. Okay. See you soon.
Thanks,
Thank you.
everyone.
Bye.
Bye, everybody.
Bye.
Bye.
Bye-bye.
Thank you.
Thank you.